Well, veterinarian Sandi Sawchuk is here.
We're taking your calls at 270-9933. Good to see you, Sandy.
Welcome
Nice
back.
to be here.
We got lots of calls, so we might as well get to them.
All right, let's get started.
You have a new bulldog, though, right?
I do. I got a new dog about, a week and a half ago.
Congratulations.
His name is Gentleman Jim Dandy, and Dandy or Danders is what we call him. He's a retired show dog who's 7.5, and we've changed the name of our home to, the Sawchuk and Larson Retirement Home for Pets. So,
Yes.
yeah, he's so far the youngest one in the household. So,
Well, hopefully when it warms up, you can bring him in and
I will.
everybody can meet him.
He's a big brute. Yeah.
All right, let's get to the calls then. We'll start with John from Madison. Hi, John.
Hello.
Hi, which question?
I have two cats. They're sisters, short-haired tabbies. And in the last 3 or 4 days, one of them has started sneezing just out of the blue. Sometimes it's once or twice, and sometimes it's 5 or 6 times in a row.
Yeah. Sneezing in a cat, it just indicates that we have something irritating the nasal passages. And there's a whole host of things that can cause it. Probably the number one thing for cats, though, is a viral infection. And it either is a brand new one, if your cat's an indoor-outdoor cat, hopefully not in this cold weather, but exposed to other cats, or it may be a virus that they were exposed to previously. It's usually a herpes virus that can come back again if they're just a little stressed. And it's kind of like us getting a cold sore again after we've, had the herpes ourselves. So a few things to be looking into. One, if your cat's appetite is good, the discharge is clear, the cat's still playful, breathing normally, I probably wouldn't worry about it. If you want to help her, you may find that giving her a little of an amino acid called lysine, you can get that online, you can get it through your veterinarian. That sometimes helps viral replication. If anything changes, blood, yellow-green discharge, change in appetite needs to be seen because it may be something more serious.
All right, very good. Carrie in Madison. Hi there, what's your question?
My dog had an operation about 3 months ago, the vertical slot surgery. And it's been 3 months now. I'm wondering, she still limps and holds her paw up, if that will get any better.
When we have a dog that runs into trouble with having back surgery done, it can take a long time for them to get back to normal. It may take months of them, and it's so important that you follow the directions of very slowly increasing activity again, working with the physical therapist to be able to make sure that your dog gets all that muscle strength back. But it just is a matter of time. It depends on how much nerve damage was done before we can, we can give you a prognosis as to how the dog's going to do. But
Time.
Yeah, time.
Okay, we'll go now to Mary from Beloit. Hi, Mary.
Hi, how you guys doing?
Good. What's your question?
Good. I have an 8-year-old Siberian Husky, and she has been diagnosed with degenerative disc disease, and they also tested her for ALS. It came back negative, but the vet did say she's showing all signs of it. She is on a half a tablet of Duramax a day, and I'm just wondering if there's anything else I can do to help her.
Yeah.
I mean, she's just a puppy, really.
Yeah, it sounds like if your dog maybe has issues with hips, that would be one of the things probably more common in a younger dog that's having troubles with their weak legs. We do know that there are some neurologic problems, just like the last caller, that can affect the spinal cord and interfere with the function of the back legs as well, which is why your veterinarian said, let's, start looking into some of these other things that could potentially cause your dog to be weak in the back end. Things that you would want to do is definitely get a good orthopedic exam done, x-rays of the hips to see if that's a problem, and then if your dog is overweight, make sure that you get that extra weight off of them. Other things that we'd look at would be putting your dog on some joint supplements besides a pain medication, which is what your dog is currently on. And there are some other pain medications that can be piggybacked with the one that your dog's on right now. And just like the last caller, physical therapy really helps these dogs to be able to keep that muscle mass and the support of the joints in the back.
Okay. Tina in Sun Prairie. Hi there. What's your question? Tina, are you there?
Yeah.
Hi, go ahead.
Oh, okay.
Go ahead.
Yeah.
So I got to ask a question again?
Yeah. What's your question?
Yeah.
My question is that we got a 1-year-old golden retriever, and she's a chewer, but we have a new kitchen.
she likes to chew drywall.
Oh my goodness! Oh my goodness!
That's tasty.
Yeah, not really.
No, I don't think so.
Not really. You know, when I hear a dog that's going through walls and doors or whatever, the first thing I think of is this is probably a behavior problem, most likely a condition called separation anxiety, which is when the dog is afraid to be left alone. They may start scratching the door, they may scratch the wall. I've even had dogs go as far as jump through windows to try to get reunited with the owner. So I think that having the dog evaluated, make sure there isn't a medical problem, but I haven't heard of any drywall deficiencies in dogs. But I'd be thinking that this would be something that needs to be approached from the behavior standpoint, and I'd be questioning why the dog is being left alone, and if there's any other things that we could be doing, like getting this dog into doggy daycare, giving him a really structured life. That may be very helpful.
A 1-year-old going through, that's a lot of energy.
That is a lot of energy, and especially with the weather we've been having, it's really hard to keep pets happy and mentally stimulated in the house. It's taking a lot on with a lot of these owners. Yeah,
to the animals and the owners as well.
Right.
Well, we can't wait to meet Jim Dandy next time.
Well, I'll bring him the next time.
All right, Sandy.
Good to
Thanks
see you,
very much.
Sandy.
You're
Thank you.
welcome.
We didn't get your calls this time. Sorry about that. We'll get to them next time. And thanks for calling in.